You're welcome to Health Check on GH today. My name is Nanama Anabempong. As you can see, I'm holding the spine, and today we are going to be speaking with Dr. Na Ashile Dodo about the lower back. Get ready, we'll be right back. Dr. Na, you are welcome to Health Check today.
Thank you.
So today we're going to be speaking about lower back pain and sciatica. So tell us, how does somebody know they have lower back pain? What will bring them to your clinic?
So one of the first or the most common symptoms of sciatica or lower back pain is some type of pain. It could be numbness, it could be a tingling sensation that most people would feel from about the middle of their back towards the waist or the lower back area. So most people have these sensations. Then they start to think if it's lower back. Could it be because they didn't sleep well? Could it be because they lifted something improperly? Their posture at work. So these are the commonest things that would bring somebody in for lower back pain.
Okay, because sometimes I get back pain, in quotes.
Okay.
And I'm sure there are many people who have it, but it's like maybe, like you're talking about, how do you differentiate between I slept funny or I've been on my feet all day versus this is lower back pain?
So if it's not going away within, I would say, a week or so, and it's still lingering on, that is when you want to investigate, because we all sleep funny every now and then. You may have done some exercise, or you may have done something funny to cause a pain, and that should resolve. In a healthy human being, 3 to 4 days, that should resolve. So if after a week or so you continue to have that pain or that sensation, and you may have taken some painkillers, for instance, and it's still not resolving, then that's the time when you need to check, investigate, find out exactly what the cause of that lower back pain is, and then seek treatment.
Okay, so 3 to 4 days to 1 week later, I've taken some painkillers, the pain's still not going. Now I'm here at Nova Wellness Center. What would you do?
So first of all, we'll have to do a very thorough history to find out if there's a previous history of lower back pain, if there are any accidents, there are any falls. What is the nature of your job? Because some people are sitting behind a desk all day long. Some people may be more of manual labor workers, so they are carpenters, they are construction workers, and so on and so on. So we really need to investigate what your daily activities are like. Is there any family history of any degenerative diseases like arthritis, which sometimes can run through families, spondylosis, scoliosis, all those fancy words we hear. So we do that thorough history, and then once we have that information, we follow up and do more of an observational test. So we look at your posture. Do you have uneven shoulders? Are your hips out of sync? Is your head bent all the way forward? Are you just looking very curved in the back? So we also observe to see if there are any signs, especially when it comes to posture. We chiropractors always say posture is the window to the spine. So we can just look at you and then have an idea of what your spine may be looking like. Okay. So posture is extremely important. And then we also do what we call a range of motion test. So how far can you bend or tilt your head to the side? You realize that some people cannot go far at all. Can you touch your toes? So we look at all these indicators, and then it helps us dive into exactly where the problem could be coming from. And then most importantly, we look at x-rays. Okay. That is how we can actually come up with a diagnosis or a working diagnosis. Is there a nerve impingement somewhere? Is there degenerative disc disease somewhere? Is there a crooked spine? And so on and so forth. So once we see the x-rays, then we can come up with a treatment plan that is focused on removing those nerve interferences to bring relief to you.
Okay, so it's a nerve something.
So that is what we deal with over here. Chiropractic is about the nervous system, and the nervous system is made up of the brain, the spine, and then the nerves that come out from the spinal cord. So when you receive a chiropractic adjustment, what you're doing is you're removing any nerve interference from the spine. That way the communication from the brain to the rest of the body is optimal. So yes, for us as chiropractors, we focus a lot on taking away any nerve interference. That way the body can function better.
Okay, now let's stay on the nerve a little bit longer, because I was told that if the pain affects your nerves very seriously, it can cause what is known as sciatica. So what is that? It sounds like some mystery, but if you can demystify it for us, then we can understand. Sure.
Sciatica is probably one of the most common lower back complications, especially here in Ghana. So what happens is that you may have a misalignment in the lower spine, or the lumbar spine as we call it, and that misalignment can affect the nerves coming out from the lumbar spine. Now there's a nerve called the sciatic nerve, which comes from what we call the second lumbar bone, so L2, L3, L4, and then it goes all the way to the bottom of the feet. Okay. So when you have a misaligned lumbar vertebrae which impinges on that sciatic nerve, commonly you can have lower back pain, and we call it sciatica because that lower back pain radiates through the sciatic nerve, and so you can have the pain through the buttocks region, through the back of the thighs, all the way to the bottom of the feet. And because that is the pathway of the sciatic nerve, that's why the condition is called sciatica.
Okay. Yes. And is it treatable?
So it's treatable to an extent, especially if we catch it early. Okay. Sometimes the impingement of the nerve may have been there for so long. Sometimes there are complications like disc bulges, like you can see in this very example. This thing looks red and it's bigger than the rest because this disc is bulging. So when it bulges for so long and it's not treated, it can impinge on the nerve root as well as the spinal cord area or the spinal canal. So when that happens, it becomes more difficult to treat. So we always say if we catch it early, especially if it hasn't gotten into the spinal canal or if it's not impinging on the spinal cord, then we can most of the time work with relieving the pressure off of that nerve root so that there's the pathway from the spine to the rest of the lower extremity is clear. However, if the condition has been there for so long and the disc degeneration is so bad, sometimes the bone can degenerate so much that you have what we call bony spurs or osteophytes. So you develop these sharp bony edges and they impinge on the disc and the nerves.
Sounds painful.
Very, very painful condition. And if nothing is done early enough, then sometimes the only thing that may help is surgery. Okay. Or spinal surgery, spinal decompression. So what the neurosurgeons will do would be to cut away some of the bone to take the pressure off of the nerve roots and the spinal cord. So that's a very, very sensitive and complex area, and we want as much as possible to prevent people from getting there in the first place. So we do the chiropractic adjustments, we do some massage, some physiotherapy, we have specific stretch therapy or stretching exercises that can help you and prevent this from getting to that point where you may need to. The spine is covered by a lot of soft tissue, so your muscles, your ligaments, the tendons, all those things cover the spine, and a lot of our daily activities cause those structures to become very stiff or very taut. So we do the stretches to help pull them out and loosen them up so that when we do the adjustment, it really complements it very well. So stretch therapy is the first thing, and then after that we go ahead and do the chiropractic adjustment. That is our medication here at Nova Wellness Center. So we do the adjustment after we have looked at the spine, after we've seen the x-rays and all that. We can tell which individual spinal vertebrae are misaligned or have gone out of their normal place. So once we detect that, we use our hands to perform that specific adjustment on that individual vertebrae. So what it does is it takes away the pressure from the nerve. That way information from the brain can flow freely. Because when we have these spinal misalignments, think of it as a blockage for the impulses from the brain to reach its destination. And that can cause so many dysfunctions or so many problems for you. So it's extremely important that throughout your life, babies, middle age, elderly, you make sure you don't have any misalignments, which sometimes we also call subluxations. So we do the chiropractic adjustment to remove those misalignments. That way your nervous system functions better, and therefore all other organs also work optimally. Sometimes we'd also do some physiotherapy. Now the type of physiotherapy we do here is mainly for the pain control, because sometimes people are in so much pain that you can't even manipulate the spine. So we do some electrotherapy, and we put these pads on the area of severe pain, run a very gentle electrical current, and that alone helps to reduce the pain so that the doctor is able to manipulate the spine to remove any pressure from the nerves.
And you said that it may make a little noise.
The adjustment, yes.
Okay.
Sometimes, not 100% of the time, but sometimes when we do the adjustment, you hear some funny noises.
Okay.
It's nothing scary. What it is that as you're breathing in and out, some gases get stuck in your joints, okay? So when we put the body in certain positions and we do the adjustment, you may hear those gases just being given off, and it sounds like a crackling noise, kind of like when you crack your knuckles. Okay. Yes, so those are the types of noises that not 100% of the time, sometimes you would hear. And then lastly, massage. We always say here that massage is not a luxury. A lot of people think it's only for the rich and famous, but we use deep tissue massage and also hot stone therapy a lot here to complement the chiropractic adjustments. Deep tissue massage is a type of massage that focuses on the muscles that lay very deep and close to the spine. And a lot of the times these muscles can get tensed from falls, accidents, degenerative diseases, and so on and so forth. So the massage therapist uses their hands to go in very deep to reach those layers of muscle, and then with several strokes and different techniques, we're able to help the muscles to relax, and that helps with circulation. It also helps with pain relief. So the hot stone massage, we use that for patients who have some nerve issues. So a common one, for instance, is stroke. When people have stroke, sometimes either the left side or the right side, it could be the upper half or the lower half or both. The muscles there become less efficient or don't work as they used to, and that's because the nerves are not sending impulses optimally. So we're able to use the hot stone massage to help regenerate or revive the nerves so that those muscles are able to function as optimally as possible. Because like I said, sometimes muscles are so tensed. You know, I've seen people who have been in maybe a car accident 20 years ago, and they may have had some misalignments. So imagine your spine being misaligned for that long. The stiffness in those muscles. Sometimes you need a very, very deep tissue massage to help release those tightness in the muscles. So if we just focus on the spine and we're aligning the spine and those muscles are still tensed, we don't get the results. So that's why we go ahead and add massage therapy, and that really helps a lot of patients get out of pain.
Dr. Na, thank you very much.
Thanks for coming, Ananda.
And that ends us on Health Check on GH today. Thanks for watching. See you again.